Okay, so I just want to do like a little improv session on the history of healthcare. Um, because there's a lot of talk about Trump and what he's going to do now he's president, and what does this mean for healthcare? Because his whole campaign, of course, everybody knows that he said he was going to repeal the Affordable Care Act, and if he does, what's going to replace it? What's going to happen to the patients who have already signed up by the millions for the ACA? If they do replace it, when are they going to replace it? I mean, there's millions of questions. Maybe not millions of questions, but there's definitely questions and a lot of uncertainty that we were all feeling. So I just wanted to go back a minute to history because I kind of think it's going to repeat itself with the Trump administration regarding healthcare. Okay, so I made a slide regarding the history of healthcare, and of course, the slide would be huge if I went into detail on what's going on. Okay, so in the 1800s, you had the woman of the house taking care of the medicine, and they only called upon the doctor, who was an apprentice at the time. He had no training whatsoever to deal with anybody who had like a near-death illness. Other than that, the woman of the house took care of the patients. I'm sorry, took care of the family, basically. And then organized medicine began in 1900s. And, keep in mind, at this time, the government was not involved in healthcare. The government was not interested in healthcare. The government left it up to the states. And the states provided funding for healthcare. And they really didn't even do that because healthcare was something only for the rich, really. If you couldn't afford healthcare, then you died. You didn't have, it's not like today. So in 1912, you have Theodore Roosevelt campaigns on the mandatory, here we are, all the way over here, whatever. He wants health, he wants healthcare for all. Everybody needs healthcare. The 1930s, the cost of healthcare increases due to increased training with the physicians, and more medical attention becomes increasingly more difficult for the middle class to afford. Well, we're talking about the 1920s to 1930s, and I mean, doesn't that kind of ring a bell now? I mean, the middle class can't really afford healthcare. I mean, the premiums are astronomically priced. So it's kind of repeating itself a little bit, and not in a good way. Blue Cross begins the first hospitals in states, and then you have 1940s to 1950s. I know Truman wanted to have healthcare for all again, and I'm using healthcare for all because that's what Trump said. He says he likes the idea of healthcare for all. He said it in his book that he wrote in 2000, and then he said it again in 2015, that he likes the idea of healthcare for all, that he's conservative but liberal on that part. He doesn't feel that people who can't afford health insurance should be without insurance. So, yes, it doesn't all get... He doesn't have the final say, but, I mean, he does have some influence. So, let's just see what he does. I know Truman wanted the same thing. What he wanted was... he wanted the worker to get paid to get health insurance, and if the worker was sick, their wages came back to them for the amount of time they were sick. And of course, the public was thrilled with this, but the American Medical Association was not happy with this and shot it down and did not want this. So that's why that didn't come about. And then, then in 1965, Social Security came. I'm sorry, Medicare for people over 65. Again, we hear that Trump wants to maybe make Medicare for all. So again, I think it's important to just take a second to go back in history. By the end of 1960s, 69% of doctors are specialists. The cost of healthcare exponentially increases after the passage of Medicare and Medicaid. 1980s to 1990s, healthcare makes a move to become more privatized as healthcare businesses began to consolidate, creating larger hospital systems. Sounds familiar. The cost of healthcare rises at a rate double the rate of inflation. Managed care groups increase to help mitigate costs. Year 2000, again, I'm going fast because this video would be hours long if I really went through in detail. Medicare's subsidiability is in question. Many also begin to doubt the efficiency of the employer-based health insurance system. Some states enact reform laws to expand coverage to larger groups of uninsured. Pharmaceutical companies advertise new medicines on TV for the public, not just for providers. You know, and we hear a lot about the pharmaceutical, how much it costs now for pharmaceuticals. That's another issue that's coming down the pike, is how much is it going to cost for our medications? I mean, I know right now my parents, they're not getting, their medications aren't even covered, and they have chronic conditions. So, I mean, it definitely hits home. And the pharmaceutical companies right now are hoping that the 21st Persons Act that just got passed, by the way, weeks ago. Everybody's watching the ACA, Affordable Care Act, but that just got passed, and they're saying, some critics are saying that it caters to the pharmaceutical companies. So it's interesting to see what's going to happen with that. And then the last is, of course, 2010 to present. Many things happen between here, but again, just for the sake of time, the Affordable Care Act is signed in. Healthcare is moving towards a merit-based incentive program. MIPS, 700,000 clinicians will qualify for MIPS, which they hate because they have to report on 4 qualities. They have to report their performance, quality, advancing care information, improvement activities, and cost. And they don't like that. Of course they don't like that. So, so we heard what Trump said already about he wants everybody to have health care. And then we saw, when we went back in time, how a couple other presidents wanted that as well. It's not a new concept. So, and anybody's familiar with Canada, that's all, everybody's on that system. Everybody's on one system. So, I don't know. I don't know what's going to happen with our healthcare. I wish I could tell you more. I don't have a crystal ball. But I do hope that they come to a resolution, and I hope that it's beneficial to everybody. And I'm sure that that's what the Trump administration wants as well. I know that they really can't make any mistakes, because one little mistake and the whole thing could really, really affect people, and not in a good way. So I'm sure that that's why they're staying tight-lipped on this. But I don't know. Keep watching my videos, and I will come out with the latest information as I get it. Thank you for tuning in. I appreciate it.